Greetings, greetings. There are some women now, they are no longer pregnant. After they've delivered, right? Whichever way you delivered, especially women that delivered through the vagina, they will notice that their lower tummy is paining them. It will look as if there is some form of movement in their lower tummy, their womb is paining them and the rest. Sometimes they get worried, they'll say, it comes once in a while, and so it can even take up to 2 weeks. They just have this tummy pain here and there, not here and there. Well, why do you think it happens? What happens is that your womb is simply contracting. It's trying to go back to the shape it was before you delivered, before you got pregnant. That's the word. Trying to go back to the shape it was before you got pregnant. That's why it's contracting. And the womb is actually in the pelvis. It is because you are pregnant, it comes to the abdomen, goes up. Now it's trying to go back to the pelvis. So that's why you notice that with time, at first, when you deliver, you will be able to touch it. But with time, you notice that you will not be able to touch it again. It keeps getting smaller and smaller and smaller and smaller until it disappears into the pelvis. When I mean disappear, it does not mean it does not exist again or it has vanished. I mean it will no longer be where you can touch it. It will now become very small. It can be very big when you are pregnant. It will still be big when you have delivered, but with time it gets smaller and smaller and smaller and smaller and smaller until you will not be able to feel it with your hand again. So that pain is because it is contracting and it's reducing in size, right? So there's nothing to worry about. And sometimes you notice that after with the pain, when the pain comes, it hooks you, then you have some form of bloody discharge and the rest, but it will clear. Thank you and bye-bye.